Thank you everyone for joining us on January 29th, 2025 for a session from the Parenting at Mealtime and Playtime program. This training is hosted by the Ohio chapter of the American Academy of Pediatrics under the Parenting at Mealtime and Playtime program. In its 20th year of funding, Parenting at Mealtime and Playtime has provided evidence-based education to physicians, nurses, home visitors, community health workers, and beyond. This year, PMP will focus on adolescent health and supporting the providers that care for them. The Ohio AAP is excited to continue the work of PMP and looks forward to diversifying its audience and topics. If you have any ideas for the toolkit, mobile app, or education throughout today's session, please share your ideas in the chat or reach out to me, Sahavi, the PMP program manager. We always appreciate feedback from our learners. Next slide, please. Thank you so much to our funder, the Ohio Department of Health, for funding this education session and supporting the health and wellness of children in Ohio. With that, today's session is hosted by Dr. Kristen Stackpole. Kristen Stackpole graduated from Miami University with a bachelor's in philosophy in interdisciplinary studies with a focus in genetics and obtained her MD at the University of Maryland School of Medicine. She completed her pediatric residency at Cincinnati Children's Hospital. Dr. Stackpole began her career working in Cincinnati Children's Emergency Department, but left after 13 years to pursue her passion for preventative health through healthy lifestyle by working for Cincinnati Children's Center for Better Health and Nutrition. She's certified in obesity medicine and pediatrics. Her career focus is patient care and is involved in research, community outreach, and education. Next slide, please. The planners, faculty, and others in control of content have no relevant financial relationships with ineligible companies. Thank you so much, Dr. Stackpole, for joining us today.
Thank you very much for inviting me today. As mentioned, I have no financial disclosures. I do, however, have a personal disclosure. There are amazing experts in the field of sleep, medical providers, researchers, psychologists. I am not one of those. I consider myself more of an enthusiast when it comes to sleep. I was asked to give this presentation as a clinician who values sleep and discusses it in her practice. So I am not an expert in the field, but I do feel passionately about our pediatric and adolescent population getting enough sleep. So today we're going to explore the recommendations for adolescent sleep, discuss the importance of sleep and the impact it has on multiple areas of health, examine practical tips for adolescents to obtain a good night's sleep, and discuss obstructive sleep apnea recommendations. The focus will be on the adolescent population. We're not going to cover subpopulations. For example, I'm not going to discuss specifically teens with autism or teens with significant sleep disorders. As humans, we spend approximately a third of our lives sleeping. From an evolutionary standpoint, this really doesn't make any sense, right? During this third of our lives, we're not feeding ourselves. We're at risk of attack. We're vulnerable. We're not hunting or protecting ourselves or our families. More than that, sleep is preserved throughout all living beings. It's amazing. So clearly, this physiological state is critical to our well-being. So what is sleep? It's a healthy, reversible physiological state with characteristic changes such as decreased skeletal muscle tone in response to external stimuli. In addition to movement and hormone changes, there are changes in brain activity. So sleep consists of a series of cycles comprised of non-rapid eye movement, or NREM, and rapid eye movement, or REM sleep. NREM is divided into 4 stages, with stage 3 and 4 being that slow wave deep sleep. The different types of sleep have different health benefits to our bodies and our brain. The distribution of NREM deep sleep and REM sleep throughout a cycle changes throughout the night. So for example, early in the night, within a cycle, we're going to have more NREM deep sleep. In the later nights, earlier, closer to the morning, within a cycle, we're going to have more REM sleep. Interesting, throughout lives, this balance between NREM deep sleep and REM sleep changes too. There is a rise in NREM deep sleep intensity in adolescence, and this is thought to be related to synaptic pruning and brain maturation. So, what drives sleep? There are two broad-reaching categories that drive sleep. The first one is our circadian rhythm, our day-night cycle. The second is sleep pressure, which is driven by adenosine. So let's talk a little bit about circadian rhythm. It's a 24-hour rhythm of our metabolism, physiology, and behavior. We have a central clock, our suprachiasmatic nucleus within the hypothalamus, and then throughout our body, we have peripheral molecular clocks in peripheral tissue throughout, including liver, muscle, cardiovascular, and adipose tissue. The circadian clock, its role is to entrain our bodies with the environment. It's regulated by endogenous factors such as genetics and physiology, environmental factors such as light, and behavioral factors such as activity and meals. The main way we stay in sync with our environment is through light. Shortwave blue light triggers melanopsin retinal receptors in the eye and entrains our central clock and our suprachiasmatic nucleus. However, there are other influences. So having healthy sleep requires having a healthy rhythm to your day. This includes exercise, meal schedule, regularly timed social interactions. So whenever I talk with an adolescent about sleep, I let them know that good sleep is influenced not just by the time you climb into bed at night, but really the rhythm of all of your behaviors throughout the day. By sleep pressure, I mean that drive to sleep when you, right before you go to bed, are just so exhausted, you think, oh my gosh, I've got to go to sleep. That's sleep pressure. So what happens is our body is making adenosine throughout the day, and it accumulates in the extracellular fluid in our brain. Adenosine causes that feeling of, oh my gosh, I need to go to sleep at night. That's what causes our sleep pressure. We clear out adenosine while we're sleeping. So napping relieves some of that sleep pressure. It's like a pop-off valve. So for our adolescents who come home after school, maybe they get home at 4, they take a nap for an hour or two after school, they're going to wipe out some of that sleep pressure. So they're not going to be tired when it's time for them to go to sleep because that nap was too close to their bedtime and they didn't have time to reaccumulate that adenosine. Caffeine blocks adenosine from attaching to its receptors, but it doesn't clear it. So when caffeine eventually is cleared by our bodies, and the mean half-life of caffeine is like 5 to 6 hours for most people, there's some variation. When our bodies clear out that caffeine, all of our adenosine is still there, ready to bind to the receptors. So that sleep pressure is going to come back in full force. But if you're a teen grabbing a cup of coffee after school or taking a pre-workout energy drink before you go to the gym or before your practice or your game, those receptors are going to be blocked. So you're not going to feel that same sleep pressure until the caffeine is cleared away. So how much sleep does a teen require? The AAP recommends that teens achieve 8 to 10 hours of sleep every night. And that's in alignment with all of the other sleep professional organizations. Keep in mind that the younger teen is definitely going to need closer to that 9 or 10 hours of sleep at night. And maybe it's the 18-year-old who can get away with closer to 8 or 9 hours of sleep. How much sleep are our teens getting? This information is from the CDC, and it looks at trends in sleep insufficiency. So a teen who's getting less than 8 hours of sleep. And you can see our teens are not getting anywhere close to enough sleep. Overall, in 2021, across the nation, 77% of teens did not get enough sleep. And that number is even higher in females, 80% in females. So what about the state of Ohio? In 2021, by the CDC's information, 81% of teens were not getting enough sleep. So let's look a little closer to home and a little more recent. According to the Youth Risk Behavior Survey in 2023, overall, only 20.3% of Ohio teens got enough sleep at night. Again, we see that females on average obtain less sleep than males. And there are also racial disparities, with Black teens getting less sleep than their white peers. I love this slide because it breaks it down by grade. And I'm sure you all have seen this in your clinics, in your practice. 9th graders, not getting enough sleep at night. Only 32% of them are getting enough sleep. But those poor juniors in high school, the 11th graders who are taking 3 AP classes and involved in multiple after school activities because they want to get into the best college possible, or are working in a paid job for the first time after school. Those juniors really take a hit when it comes to sleep. And you can see only 13.9% of them are getting sufficient sleep. And again, if we look at things historically, you can see the trend of getting enough sleep is decreasing. So insufficient sleep is increasing. And you can see that in comparing 2013, for example, to 2023. So the duration of sleep is very important to our well-being. But thinking back to the circadian rhythm, the timing of our sleep matters also. When your sleep pattern is disrupted, we have circadian misalignment. We can see this with night light exposure. Certainly, we see it with shift workers and adults. Lots of studies have been done in that population. For our patients, we see this all of the time in the form of social jet lag. So kids are staying up later on weekends, trying to transition back to school time sleep on Monday. Certainly coming out of winter break, we're seeing this in our patients. After winter break or summer break, trying to transition back to the school schedule can be so hard. Circadian misalignment is associated with metabolic and cardiovascular disease. So when we're talking to a teen with prediabetes, for example, who's staying up all night during summer or winter break, who might technically be getting enough sleep, but they're getting more daytime sleep than nighttime sleep, they need to be aware that they're not getting all of the benefits that they should be from their sleep. They are going to have less insulin sensitivity because of their circadian misalignment, the same way they would have less insulin sensitivity with insufficient sleep duration. So I don't know how many of you were able to tune into the last webinar produced by Parenting at Mealtime and Playtime. The previous speaker, Tiffany Ryback, in her talk on Thriving Teens, talked about values-based decision-making for teens. She discussed supporting teens, identifying and acting on what is important to them as individuals. And that's exactly the approach I take with sleep. At the beginning of today's talk, I mentioned that a third of our lives are spent sleeping. And from the outside, that seems like a waste of time. We're not doing homework. We're not hanging out with friends. We're not playing video games. So why waste so much time sleeping? To help my patients understand the importance of sleep, I need to understand and connect with what's important to them. So I'm going to review the benefits of sleep organized in categories based on common values and priorities for the teens that I work with. I often tell my teenage teens, if you talk to 10 different doctors in 10 different areas of specialty and your coaches and your teachers, every single one of us are going to say you need to get enough sleep. But we'll all have a different reason for you getting enough sleep, because sleep is so important to every aspect of our well-being. If you are spending an hour of your day watching this webinar, you clearly care about teens and their health. And we all see the high prevalence of depression and anxiety that teens are experiencing. Many sleep and mental health problems are bidirectional. Depression and anxiety compromise quality sleep, and sleep deprivation or circadian misalignment worsens depression and anxiety. Addressing depression and anxiety in our patient requires addressing sleep also. Earlier, I stated that I discussed sleep, keeping in mind what is important to our individual patient. Educating a patient who is struggling with depression or anxiety on the importance of sleep allows them to make an informed decision if sleep is something they want to work on or not. So from a mental health standpoint, chronic sleep deficits increase risk of depression. Adequate sleep helps us process and regulate emotions. Adequate sleep helps us regulate our stress level. And adequate REM sleep in particular affects how accurately people can perceive and process external stimuli. So the comment someone says in class or the facial expression that someone has, we're going to interpret that and process it more accurately if we're well rested. What about school performance? We mentioned those juniors who don't have time to sleep at night because they're busy studying. Well, there's something that Matthew Walker, a big sleep researcher, said. Sleep before learning helps prepare your brain for initial formation of memories, and sleep after learning is essential to help save and cement that new information into the architecture of your brain. I love that. I use that all of the time with my patients. So basically, you're less likely to forget what you learned if you've gotten a good night's sleep the night before you learn it and the night after you learn it. Sleeping solidifies memories formed during the day. It also links new memories to earlier ones. It helps produce creative ideas. Sleep reduces mental fatigue. It improves focus, attention to detail, problem solving, higher level reasoning. One study showed a lack of sleep can cut learning ability up to 40%, and it's associated with a lack of motivation. So when you have a teen who is up all night studying, I really try to stress they are going to be more effective learners. They're going to ultimately be more successful if they get a good night's sleep. When students are taking AP classes and their testing is going to be cumulative, I think this is extra important. I remind them it is so important to have those memories cemented into your brain so that you're not relearning it all when you go to take that test at the end of the year. I find that when I'm working with athletes, getting enough sleep is an easier sell these days. I think coaches are very well informed on the importance of sleep. And interestingly, this is like one good thing with social media. I think professional athletes on their social media are much more vocal about the importance of sleep and how that plays in their training and the great efforts they go to make sure they get a good night's sleep when they're traveling with their team. So when I'm talking to someone who's serious about sport, I am not the first person who's bringing up a good night's sleep to them. But I do let them know, if you want to perform your best on the field or on the court, you're going to have quicker reflexes if you get enough sleep. You think more clearly and you have improved focus, so you're going to have better decisions on the field or court. Growth hormone is predominantly released during deep sleep. Lack of sleep causes suppression of this. Sleep is essential for muscle recovery. The whole concept of muscle memory is brain memory. It's when you sleep, all of those new skills you learn become locked into your memory. And lack of sleep is associated with increased risk of sport injury. So if I have someone who's injured in sport, I remind them that getting enough sleep, one, helps them recover from the injury, and two, will help prevent further injury. This is actually what I do all day. My focus is metabolic health and weight management. So short sleep is associated with overweight status and obesity weight status in children. Lack of sleep causes insulin resistance, decreased leptin production, increased ghrelin production. So what that means for my patients is that they are not going to regulate their blood sugar as efficiently if they're sleep deprived as if they were well rested. They're going to store more energy in the form of fat. Their leptin signaling isn't going to work as well, so they're not going to get those cues of, hey, my brain is seeing enough leptin. I have enough energy in reserve in the form of adipose tissue. I don't need to eat more. I can go ahead and move my body as much as I want. I have plenty of energy in reserve in the form of adipose tissue. They're not going to be getting as much of that signaling. And lack of sleep causes increase in ghrelin production. Ghrelin is a major circulating hunger hormone. So not only are you hungrier, but with increased ghrelin, you tend to crave more calorically dense foods. So those higher sugar, higher fat foods. So if you're working really hard on reversing your prediabetes, for example, it is hard to make those healthier food choices if you're sleep deprived. Shorter sleep duration and later sleep onset is associated with hypertension in youth. There was a very nice study within the past 12 months that came out demonstrating that. Admittedly, most of my patients don't really care about dementia prevention at this point, but every once in a while, I do have a teen who has a grandparent living with dementia, living in their home, or even like an older aunt or uncle. And, that is something that they see and want to do everything possible to avoid. And I let them know, hey, we have known for years that exercise is important for maintaining healthy brains while we age. But more and more research shows that adequate sleep is also important in dementia prevention. When we sleep, our brain removes toxic waste byproducts, which may have accumulated throughout the day. This happens through our lymphatic system, which is composed of these fluid-filled channels in our brain. So getting enough sleep is critical for dementia prevention. This time of year, when every illness seems to be going around, sleep and its connection to the immune system is important. I'm sure many of us have had patients say, I am so sick of getting sick. What can I do to prevent getting every single cold that goes through my school. All right, in addition to washing your hands and eating a diet rich in fruits and vegetables and exercising every day, you need to get enough sleep. Lack of sleep increases risk of infection. Interestingly, adequate sleep has been shown to yield a stronger protective effect after vaccines. So if you don't want to get sick, get a good night's sleep. Obviously, there are a lot of new teenage drivers. That's, 16 to 18 is a pretty popular time to get your license. And I do think it's important that they know that lack of sleep is associated with a higher rate of traffic accidents. Drowsy driving is dangerous. More traffic accidents are caused by drowsy driving than drunk driving. Obviously, our teens shouldn't be drinking and driving either, but they should not be driving when they're exhausted or even chronically sleep deprived. And as parents need to know that also. Getting a good night's sleep improves attention. You have quicker reflexes. Those things are important to driving well. I am not above using video games to encourage my patients to get more sleep. Again, I try to focus on what is important to my patients. And as it turns out, how well they play video games tends to be pretty important. I let them know they're going to have quicker reflexes. They're going to think more clearly. They're going to have improved focus and attention. They will be more effective, better skilled video game players if they get enough sleep at night. Very often I get pushback from teens because now everyone is constantly connected to everyone else, right? So my teens are very often playing video games with their friends who happen to live in a different time zone, maybe 14 hours ahead of us. So I have had, and I'm sure you all have, plenty of conversations where the teen will tell me, I cannot go to bed any earlier. All of my friends play video games at 2 a.m, 3 a.m. That's the only time I can play with my friends. Well, clearly this patient is very concerned about playing video games. I get it. I remind them that if they're playing with someone in a different time zone, the person they're playing against is playing after school. So that patient, or excuse me, that person that their friend that they're playing against is well rested. They just got home from school and probably had a snack. They're not getting in trouble with their parents. They're still getting their homework done. They're getting a good night's sleep. They're performing well in school, and they're going to perform better in video games because they're doing it at a time when they should be awake versus what is for them the middle of the night. So social connection is important. Friendships are so important in adolescence. And obviously there could be several more webinars just on friendships through the internet and, all of those multiple issues. But I encourage my patients to play video games with maybe people more local who are in the same time zone and playing at a time that allows them to perform at their best versus performing at a disadvantage. Admittedly, there are some serious challenges for teens getting enough sleep. We just talked about friends in different time zones. One thing that I think is extremely important to acknowledge, including to parents of teens who might be concerned about their teen's sleep schedule, adolescents all around the world, in all different cultures, have a shift in their sleep timing. They have a natural shift in their circadian rhythm. They normally stay up later and sleep in later. That's biological. It's not choice. Unfortunately, our school systems are not necessarily on board with this. I'm thrilled that some of our local school systems have started switching to a later start time. But unfortunately, that is not universal. So our teens who normally are staying up late often have to wake up at 5 a.m. to catch the bus before they get to school. That is a huge challenge for them. Additionally, there is constant connection. You know, decades ago, there were maybe a few good shows on between 8 and 9 p.m. or 7 and 9 p.m. Now you can watch whatever you want, whenever you want. You just stream your favorite show. You talk with people online. You see what people are up to. It's 24/7. That's a challenge for our patients. They have to be very deliberate in shutting that out, turning it off, disconnecting. Another big barrier for our teens is years ago, our bedrooms were kind of cut off from the rest of the world. We didn't necessarily have friends in our room 24/7 again. Rooms were our space to kind of get away from the world, quiet time to go to sleep. Now, kids can be in their beds talking to their phones, watching TV. Bedrooms and beds are no longer kind of sacred spaces for sleep. So our brains are not necessarily associating our bed with, okay, now it's time to sleep. Maybe our brain is associating our bed with, oh my gosh, who said what about me on social media? It actually can be very anxiety provoking and stressful for them. There are definite racial, ethnic, and socioeconomical disparities in adolescent sleep health. Adolescents of racial and ethnic minoritized backgrounds and those living in lower socioeconomic status environments experience poor sleep than white or higher socioeconomic status peers. This figure shows the many social determinants of health that influence sleep. A few in there are positive, such as you have a longer sleep duration if you tend to have positive peer influences and positive parental influences. But just to highlight a few of the many social determinants of health that are associated with shorter sleep duration: negative life events, perceived neighborhood safety, perceived school safety, nighttime outdoor artificial light, food insecurity, working a paid job, having household chaos. All of those things impact our teens' ability to sleep and need to be addressed to the best of our ability. It might be referring them to a therapist for counseling with having some coping mechanisms for the stresses they're experiencing in their neighborhood or at school. If there's a lot of external environmental light, maybe they just take a t-shirt and roll it up and drape it over their eyes at night to kind of block out some of that light. Maybe they run a fan in the background to provide white noise to help counteract some of the louder noise in their neighborhood or in their home. I've had multiple parents tell me that they feel they need to keep the television on because they want people going by their apartment or their home to know someone is home. They feel like that's a measure of safety. But that can be challenging for a teen who's trying to sleep that hears the TV going in their room potentially, or in, the room next to theirs. So again, maybe having some background noise, draping a t-shirt over your eyes, little things that we can help brainstorm with them about to help combat some of these challenges are important. Obviously, if sleep is so important, we have to know how to assess it. You're probably familiar with Bears evaluation, the questions. There are different questions based on age for assessing sleep. So for 13 to 18-year-olds, B is bedtime problems. Do you have problems falling asleep? E, do you have excessive daytime sleepiness? Do you feel sleepy a lot during the day? Do you feel sleepy in school? Do you feel sleepy when you're driving? A is awakening. Do you wake up a lot at night? Do you have trouble getting back to sleep? R is regularity of sleep-wake cycle. What time do you go to bed on school nights? What time do you wake up on school days? What is your weekend schedule like? S is snoring. Maybe you have to ask the parent this because the teen is asleep. Does your teenager snore? If you're talking to the teen alone, hey, have your friends ever mentioned that you snore if you've had a sleepover? Do your siblings say that you snore? Typically, snorers have been told by someone that they snore, not always, but often. So if you've done a sleep assessment and determined that your patient is not getting enough sleep at night, and you've discussed with your patient how getting adequate sleep can help them achieve their goals based on what is important to them, I always ask them if getting more sleep is something they want to work on. If they say no, fine, then that's okay. We don't need to talk about it. I do let them know in the future if they change their mind, send me a note, give us a call. I can always give them information on sleep in the future, and we can circle back to it at the next visit in case that's something they've decided they do want to work on. When I think of tips for sleep, I kind of break it down into categories. One is rhythm, having a healthy rhythm to your day. Do you go to bed and wake up at the same time each school day? What about on weekends and school breaks? You want to keep your sleep schedule ideally to within 30 minutes of your weekend schedule. So if you were trying to go to bed at 10 on school nights, staying up until 3 on weekends is not great. I will tell you, when I recommend keeping it to a 30-minute window, I get a lot of, you've got to be kidding me. There's no way I'm not going to do that. So I usually say, okay, absolutely no later than 2 hours then. So if you're going to bed at 10 o'clock on a school night, try to make midnight the cutoff for weekends or school breaks. Similarly, waking up needs to be on a schedule too. So I encourage patients to set an alarm, get up at a regular time every day also, including weekends. And not just to set an alarm to wake up, but to set an alarm to remind themselves that it's time to wind down to get ready for bed. It's easy to get lost on their devices. So setting an alarm can be a good reminder that it's time to wind down and get ready for sleep. Way back in the beginning of the talk, I mentioned having a healthy rhythm to all of your daily activities impact sleep. That means having regular daily meal times, including breakfast, daily exercise. You do want to avoid eating too close or exercising too close to your desired bedtime. And because of our school schedules, I encourage teens to avoid naps after school. Sure, there are lots of cultures that have siestas built in. Our kids get home from school too late for those naps not to interfere with getting to bed and getting a good night's sleep. If they are going to nap, I encourage it to be no more than 30 to 45 minutes and in the early afternoon, which again isn't really possible for most of our teens based on when they're getting home from school. We already established light is important to setting our biological clocks, our biological sleep-wake cycle. So getting outside every day, especially in the morning, to expose our eyes to natural light can really help our sleep rhythm. In the evening, you want to decrease your light exposure. So I encourage teens to try using twilight brightness blocker apps on their phones or blue light filters on devices an hour or two before bed. If their lights can be dimmed, great, dim them. Maybe you turn off an overhead light and use a desk light if that's possible, but really try to decrease light exposure in the evening and to turn off all screens at least 30 minutes before bed. Sleeping in a dark room without devices, without television, without lights is really important, not just for your sleep, but even for your eye health. Again, if, for example, you have a patient who is sharing a room with their 21-year-old sibling or cousin, and that sibling or cousin is working and has a different sleep schedule, maybe there is a night light on in the room so that older person can come into the room without turning on lights, get ready to bed, go to bed, and our teen drapes a cloth over their eye to help them get a good night's sleep and not have the light that's on in the room. Again, this is not under light, but having background noise like a fan going or some white noise can help that disruption of the other person coming into the room also. Caffeine. Ideally, teens are not getting it at least 6 hours before they're trying to go to bed. Ideally, they would limit it to the morning. Remember, caffeine is not just tea or coffee anymore. It's energy drinks, it's pre-workout drinks, it's lemonade, for goodness sakes. We have caffeine infused in everything. So you want to educate your teens on all of the many products they could be consuming that have that have caffeine in them, so they can make smart choices about it. The next category is calm. You want to spend time before bed calming your mind and body. So avoiding stimulating activities such as video games and social media at least 30 minutes before bed. I encourage teens to try calming activities such as listening to music, drawing, journalizing, organizing themselves for the next day, and to have a regular calming bedtime routine. As important as it is for toddlers to have their bedtime routine, we all need a bedtime routine, including teens, whether it's just turning off their screens, putting on some calming music, brushing their teeth, washing their face, packing their backpack for the next day, whatever it takes for them to just calm their body and their minds down. A lot of times I will have teens that tell me that they try really hard, but they just can't get their brains to calm down. And I'll teach them some deep breathing, a deep belly breath in through your nose, a slow exhale through your mouth. And you want that exhale to be longer than the inhale. Just a few deep belly breaths can help decrease the sympathetic nervous system. Let that parasympathetic have a little bit more weight. So just a few deep breathing techniques can help. Progressive muscle relaxation can help also when you first climb into bed. And there are lots of free apps and even downloadable books from the library that have those in there that teens can use. Again, using some calming music, background Noise can help block out some of that external noise. And then this is key and challenging for our teens. I encourage them, especially if they're having any difficulty with sleep, to use their bed only for sleep. I tell them, just like you program a computer, you want your brain to know, I'm climbing in bed, it's time for me to calm down and sleep. It's not time for me to wonder what my friend is doing. It's not time for me to stress about the exam that I've been studying for in bed all day long. You know, it's really time just to wind down and sleep. And I know teens often use their beds like as couches and desks and everything else. And I get it. You know, teens need their space, maybe separate from the rest of the family. So I'll say, hey, if you don't have another piece of furniture in your room, throw a couple pillows and a blanket in one of your corners and make like a little nook for yourself that you can read your book or scroll on your phone. Just try not to do it in bed. The sleep medicine doctors really recommend going to bed when you feel tired and ready to sleep. You don't want to lay in bed frustrated about not being able to sleep. Again, we want our body and brain to be programmed. I'm in bed, it's time to relax and go to sleep. So if you're not tired, do a calming activity for a little bit more, then get back into bed. Similarly, for our teens who are waking up in the middle of the night, rather than lying in bed getting frustrated, maybe they get up, do some deep breathing, do some relaxation, and try getting back into bed. Reading a paper book outside of bed is another option. And they also really recommend getting out of bed within 15 minutes of waking up in the morning. So if you're supposed to get up at bed at 7, don't hit snooze until 7:30. Just get out of bed. Again, you want your brain to associate laying in bed with sleep. Okay, I know I'm getting tight on time. I'm going to briefly touch on insomnia and sleep apnea, the two very common sleep disorders. So for insomnia, your patient might have insomnia if they report one or more of the following symptoms: difficulty falling asleep, difficulty staying asleep, or waking earlier than desired. And one or more associated symptom: fatigue, impaired attention, daytime sleepiness, dissatisfaction with sleep. Chronic insomnia is defined as at least 3 times per week for 3 months. Short-term insomnia is less than 3 months. Key, you have to give yourself adequate sleep opportunity. It's not insomnia if you're only giving yourself 5 hours to sleep. Sleep hygiene and cognitive behavioral therapy are the treatments for insomnia, not medication. Sleep hygiene, cognitive behavioral therapy. And there are some great apps available, such as the Calm app, CPTI Coach app, that can help with insomnia behaviors also. Sleep apnea. Obstructive sleep apnea syndrome is prolonged partial or intermittent complete upper airway obstruction, resulting in disruption in normal ventilation during sleep and normal sleep patterns. Symptoms include snoring, especially if it's more than 3 days per week, often associated with pauses, snorts, gasps, sleep enuresis, sleeping in a seated position, sleeping with your neck extended, cyanosis, never a good thing, headaches on waking, daytime sleepiness, learning problems, ADHD behaviors. On physical exam, you're at higher risk of sleep apnea if you're underweight or overweight, if you have tonsillar hypertrophy, adenoidal facies, micrognathia, retrognathia, high arch palate, hypertension. Importantly, the AAP recommends that all adolescents and children should be screened for snoring. A sleep study should be performed in any patients with snoring and symptoms and signs of sleep apnea. Tonsillectomy is the first line of treatment, especially, well, if you have enlarged tonsils and adenoids. CPAP can be used as treatment if if you're not a candidate for a TNA, or if you still have sleep apnea afterwards. Sometimes sleep medicine doctors will use intranasal corticosteroids in children with mild sleep apnea who aren't candidates for surgery. Okay, there is a wonderful formal questionnaire called the Pediatric Sleep Questionnaire that has a sensitivity of like 81%. And a specificity of about 87%. So very, very good for diagnosing sleep apnea. 22 questions. It tends to be a little long if you're incorporating this into your overall visit. So I just ask, does your teen snore? If yes, how many nights per week? Is there any choking, gasping, snorting, or pauses? Do you wake with headaches? Do you have daytime sleepiness? Difficulty concentrating? Are you a restless sleeper? Do you wake up frequently to urinate? Do they have any of the physical symptoms like enlarged tonsils? Okay, moving right along. I was asked to talk about melatonin because I think we all get asked about melatonin all of the time, right? Melatonin is a major signal in our circadian rhythm. It is released by our pineal gland at night. It rises shortly after dusk, and it's an important way that our bodies regulate the timing of sleep. It does not generate sleep. It just lets our body know it's time to sleep. And then in the morning, with the light of dawn, we stop, our melatonin levels decrease. So we should have a lot of melatonin at night in the dark, and it should go away in the daytime. That is why light is so very important to our sleep. Important things to know. Melatonin supplements are supplements. They are not FDA regulated. So there is not any guarantee that what is on the label in terms of ingredients or dosing is what is in the container. For all supplements, we need to let all of our parents know if you're using a supplement, melatonin or otherwise, it must be third-party tested. There's USP verification is a third party that will test supplements, and it will have a USP label or like stamp on the label. So if a parent is choosing to use melatonin for their teen, at least let's educate them that it needs to be third party tested. We want them to use the lowest dose possible. They really need to limit light before bed and do calming activities, or this is not going to be effective. Melatonin might be helpful short term in establishing a healthy sleep hygiene or resetting that sleep schedule when you're transitioning from breaks to the school year. That's a short-term use that might be very helpful to try melatonin if a child's really struggling despite having good sleep hygiene. There's some consideration for teens who, because of their circadian shift, really have difficulty falling asleep and waking for school. There's no long-term use data on this. Again, sleep hygiene is key, but melatonin could have some benefit to it. Okay, I have some case studies, but I've obviously talked long enough, so I'm going to make myself quiet and allow questions to come through.
Thank you, Dr. Stackpole. If you have any questions, you can put them in the chat or unmute and ask them out loud. Okay, hearing no questions and seeing none in the chat. We got two comments that this is great information. So thank you so much, Dr. Stackpole. If you want to advance to the next couple slides. All right. Thank you so much again, Dr. Stackpole, for facilitating such a great training today. And thank you all for coming. Please check your email to claim your CME or MOC credit. We ask that all participants complete the short survey, even if you do not plan to claim the credit. This will enable us to collect endpoint data to measure the rigor of our programming. Once you complete the survey, you will receive a certificate within 10 days. I will follow up with these directions via email for your reference, and in that email will also be the upcoming PMP education. If you have any questions or suggestions for future PMP programming, please call or email me at the contact information listed here. And you can go to the next slide. Oh, I apologize. This is our registration page. We were figuring out final dates for that session. If you want to just jump back one more, you can scan the QR code on the next slide to register for our upcoming education that will be in May of this year.
Do you want me to flip it?
Please.
Great.
These will be on May 8th and May 20th of this year. If you have any questions or suggestions for future PMP programming, like I mentioned before, please feel free to give me a call or email me, and I'll put my email in the chat. This concludes today's training session. Thank you all for your time and energy, and I hope to see you in another Ohio AAP training session.